Welcome to Adapt NCLEX. Are you overthinking NCLEX questions or nursery school questions on newborn? Just hold on, please. Most of the time, the right answer is just plain common sense. In this video, I'm going to break down high yield newborn assessment questions every nursing student is supposed to know if you're taking the NCLEX or in your nursing school. And I'll show you how to use simple logic to get these right questions all the time. Let's make newborn questions easy. Stick around. Let me show you 10 high-yield questions and pick it from different areas to show you that common sense, even if you have no idea, you'll be able to tackle these questions. First question, as you can see, is testing something. There's numbers there. That means you need to know certain numbers. Which of the following finding the nurse should report to the provider? That means you got to pay attention to these words and this information, something there that is very concerning. Prioritization question 101. A nurse is caring for a newborn who is 30 minutes old. Let your brain go back and look for the buzzword. The buzzword is I'm born, I have 30 minutes. I've not even stayed in the world for 1 hour, 30 minutes. What should you worry about? What do you see that is consistent? My respiratory rate is 64. My heart rate is 45. My lips are blue. And I have irregular breathing with pauses. Think about it. Something should tell you as soon as the newborn is born, they will be crying. They'll be doing all those things. And their heart rate is the beginning of them adjusting to the environment. So their heart rate is going to be high. They breathe very fast. So they breathe very fast. The heart rate is very high. And sometimes there are pauses. They stop breathing and they will start all over again. Just by this tells you, if your lips are blue, that's not normal. Your fingertips and your toes can be blue. That's what we call aqueous cyanosis. But when you're blue on your lips and your face, this is central cyanosis. Therefore, number 3, the nurse should do something about it. This is not normal. I should worry about it and call the doctor. What is the primary reason for this intervention? That means you have to know a little bit of content. A newborn is placed under radiant warmer immediately after birth. But guess what? Buzzword is the key. If you want to learn how to answer questions, stop the video, answer them, then listen to the way I approach it. Restart the video and see how I approach it. I'm going for the buzzword. It's a primary reason. What primary reason? Radiant warmer. Even if I have no clue, common sense tell me that logic that warmer, something about heat. Therefore, my answer choice, it has to relate it to I'm treating something related to heat. That's all. There's nothing. If I don't know radiant, I don't care. I'm going for the buzzword, which is a warmer. A warmer heats things up. Therefore, I'm picking an answer where it has something to do about heat and temperature. Hypoglycemia has nothing to do about warmer. Breathing, nothing to do about warmer. I see body temperature, I say, oh, maybe this is a trap. To reduce infection, a warmer does not reduce infection, right? A warmer is going to warm you up. Therefore, number 3 is your right answer. As you can see, I'm using straightforward common sense. Which newborn action indicate the need for immediate intervention? That means the newborn did something that I don't like, should concern me. I get to intervene. Let the doctor know. Should be a prioritization. You see the words? It should be ringing in your ear. Sneezing occasionally. Do you think is something you should call the doctor for? Nasal flaring during breathing. It's breathing, but his nose is flaring, trying to open it to get more air. Monroe reflex when you startle the baby, right? The word say newborn. How long should Monroe reflex stay? That's the keyword. Passing meconium with 24 hours. Then step back and ask yourself. They said I should report something. Therefore, if I see something that is good, why would I report it? Number 4, I pass meconium. Hey, that's good. If you poop meconium, that is good within 24 hours. Why would I tell the doctor the baby poop? It's not important right now. If the baby is sleeping and you startle them, they have mono reflex, they tell you neurologically they are intact at that age. But when they're breathing, their nose is just opening up wide. I should worry. If he's sneezing, well, he gets some allergy. Who cares? Number two is your boy. You see what I'm doing? I'm trying to show you how you can step back. Don't use tunnel vision. Use peripheral and tunnel vision and see the whole picture. Which of the following should the nurse do first? Prioritization. And this is assessing a newborn who was born, 10 minutes ago? Once again, not even 30 minutes. This one is 10 minutes. I'm trying to let you think that answers are in the question and then flip the question and figure out 10 minutes. What is the most important for a baby that is born? Do you give them vitamin K so that they don't bleed? Do you stimulate the baby to make sure he's breathing and he's drying so that there's no hypothermia issue, thermoregulation? Do you apply erythromycin to the baby eyes to prevent infection after passing through the vaginal canal? Do you place identification band on so that baby doesn't get lost? It's 10 minutes. 10 minutes. What would you do? What would you do? Always baby lose temperature so fast. As soon as they born, you see them wrapping around, wrapping around. I think I have time to give them vitamin K. I have time to give them erythromycin. I have time to put a wristband on. But 10 minutes, the most important is I gotta protect the baby from what? Cold stress. So stimulate them, let them cry, let the muscle contract, and you warm them up. Number two is your friend. I know a lot of people will pick four, but common sense why 10 minutes is not enough time. As soon as that means that you're trying to clean the baby and get them ready, wristband is usually before they get out of the operating room. Which of the following is the best sign that a newborn is getting enough breast? Keyword, enough breast. Keyword, enough breast milk, right? A newborn cries often. When the baby cries, does that indicate that they're getting enough breast milk? A newborn sleeps for a long period. Is he full? That's why he's sleeping. A newborn has 6 to 8 wet diaper, right? What goes in comes out, right? A newborn report breast tendon. A mother report breast tendon. Mommy breast is hurting. Is she emptying it or the baby is not suckling? But think about it. In a newborn, whatever go in comes out. Common sense. If you cry, there's no indication that you're eating. If you're sleeping long, it doesn't mean you having enough breast milk. You may be crying and you fall asleep. The best thing is what goes in comes out. 6 to 8 diapers per day indicate adequate hydration. And this is teaching a new parent how to care for the umbilical cord. I don't know how to care for it, but I'm going to look at the answer choice. Whatever does not make sense, he said further teaching. That means I did something that is wrong. Expect questions like that, umbilical cord, something on treatment or management of wound, that parents would do things that call folk medicine. Somebody told them to do it, right? They read it online. So watch for that. Always watch for that kind of answer. I fold the diaper below the stump. Well, if the umbilicus is now healing, yeah, don't let any dirty diaper get to the stump. That is good. Does not need further teaching. I will clean the area with alcohol at each diaper. Is it good to use alcohol or hydrogen peroxide or just let it be? I'll give my baby a sponge bath until the cord falls off, cleaning the baby for dirty stuff, right? I will call the provider if I see redness, foul smelling, signs of infection, right? What do you think? The most inadequate, bad answer look like folk medicine is the use of alcohol. Sponge bath prevent the what? The umbilical is getting wet, right? You sponge bath, there's nothing wrong with it. Providing Calling when there's signs of infection is good. And preventing the diaper from rubbing the stump is good. You put in alcohol and it look like you're cleaning, but you're causing more problem. Two, need further teaching. Which situation require the nurse to intervene? That means you got to intervene. A newborn is sleeping in the crib in the mother's hospital room, right? A newborn is sleeping in the crib in the mother's hospital room. Which situation require the nurse to intervene? The baby is swaddled and laying on its back. The mother places a small pillow under the baby's head. The bassinet is next to the mother's bed. The baby is dressed in a sleep sack. Look at all the questions. What is he trying to tell you? He's trying to tell you about sleeping hygiene for newborn. A sleep sack is going to warm the baby. Should you intervene? A bassinet is near the mother so that nobody can come and steal the baby. Protection. The mother places a small pillow under there to help the baby head, right? To get and so that it doesn't hurt the baby. The baby is swaddled and laying on their back, right? If you look at it, one is the best way to put them, right? They swaddle in the fetal position in the back to prevent SID, right? Sudden infant death syndrome. There should be nothing in the crib. Absolutely nothing to coexist with the baby. So two is a trap. There should be no pillow, whether it's small or tiny. This is a sign of suffocation. A bassinet near the mother is good. Baby is dressed in sleep sack is good. Two, need further intervention. A newborn blood glucose is 38. That means it's low, an hour of life. You want energy, you want food. What is the next priority action? Notify the air care provider. Well, prioritization, right? Recheck the glucose in 4 hours. Prioritization. Feed the newborn immediately. Prioritization. Start IV dextrose. Prioritization. Go back with a little bit of content. When somebody is hypoglycemic, you ask yourself, are they conscious or unconscious? If they're conscious, you can feed the mouth and give them sugar through the mouth. IV dextrose is somebody who cannot, is unconscious, or they have a very severe form of hypoglycemia. 4 is gone. Feed a newborn immediately. Well, he's hungry, he's hypoglycemic, he just got born an hour ago. Feed the baby. Recheck the glucose, you can't wait for another 4 hours. Notify the air care provider, you can do something before you call the doctor. So let the mommy feed the baby or feed the baby immediately. A newborn is preparing to administer, a nurse is preparing to administer erythromycin or ophthalmic ointment to the newborn. What is the purpose of this medication? We talk about it. This one is straightforward. You got to know whether you like it or not. Erythromycin is used to prevent chlamydia and gonorrhea and to prevent eye infections. It's one of the things the newborn will get before they leave the hospital. So 3, straightforward. A nurse walks into the postpartum room and sees the newborn in bed with the mother, both asleep. So they're all sharing a bed. What do? It's the same content I keep on repeating, right? Nothing in the crib with the baby, whether your mommy or pillow or a bunch of stuff. Wake the mother and encourage her to continue bonding. Well, this is not bonding. Mommy is going to cause suffocation. Run over the baby. Quietly leave the room to avoid disturbing them. Don't do that. You got to intervene. Best action. Gently move the baby to the bassinet, right? And document skin to skin care is occurring. You can see that's taking strategy in common sense. 1, 2, and 4 almost saying the same thing. 3 telling you, no, take the baby away. All the rest, allow the baby to stay with the mother. This is adapting class. Number 3 is your right answer. Thank you for watching Common Sense for the Newborn Assessment. This is the way you should approach it. If you like this video, share, put the like button or put a comment. Let me respond for you. If you want more content like that, join our membership. Take care of yourself. Good luck in your exams in nursing school. You got this. Bye.